Hello and welcome to Askimo TV. I'm talking today to Dr. Nisith Sheth. Dr. Sheth is a consultant dermatologist and dermatological surgeon at St. John's Institute of Dermatology in London. Hi, Dr. Sheth, how are you?
Hi, very well, thank you.
Dr. Sheth, let's talk today about eczema. So let's begin with, what is eczema?
So eczema is actually a group of conditions characterized by an inflammation of the skin, which impairs the protective barrier of the skin. It can lead to dry, scaly, itchy skin, and in other cases can lead to weeping, crusting and oozing, particularly if there's, for example, an infection on top of it. There are a number of different types of eczema, but the most common is atopic eczema, which affects predominantly children, but can go on into adulthood.
What causes eczema and who's at risk?
The causes of eczema aren't completely understood, and it's certainly what we call a multifactorial condition. So there are many things which will contribute to it. There are certainly some genetic factors. So for example, in atopic eczema, there will be a family history of either eczema, asthma or hay fever. The way the immune system develops also contributes. Environmental factors certainly contribute to eczema. So for example, atopic eczema is very much triggered by house dust mite in many patients. In other types of eczema, environmental factors such as things that you may come into contact with may cause a contact eczema. So, for example, some people develop eczema if they become allergic to fragrances or detergents.
What are the signs and symptoms of eczema?
So for many people, the signs are dryness of the skin, scaling, irritation. In atopic eczema, these often occur at what we call flexural sites, so the creases of the elbows or the knees. When they scratch a lot, sometimes you can get oozing and weeping on top of this.
What are some of the most successful treatment options available for eczema?
The mainstay treatment of eczema, and probably the most effective treatments, are those which will help maintain the integrity and protective function of the skin. And so this is basically emollients, moisturizers, soap substitutes, which can replenish many of the oils that are lost and not being able to be retained because of the eczema. Where eczema is not controlled by these, anti-inflammatory creams such as steroid creams and newer agents such as what we call calcineurin inhibitors can be very effective. And for the most severe types of eczema, ultraviolet light therapy and oral therapy or systemic therapy may be required.
Is eczema curable, or is it just about management of this condition?
Currently, eczema isn't a curable condition, but the symptoms can be very well controlled and managed in many patients with appropriate treatment and lifestyle changes. The majority of children with eczema do actually grow out of eczema later on in childhood, at around about 7 years of age, but a proportion will go on to have it in adulthood.
Just to end off, what sort of lifestyle changes should a person with eczema make?
So there are a number of things that can help with eczema. The environment that they live in can help. So, for example, reducing the amount of house dust mite in the house from careful selection and maintenance of carpets, curtains, bed linen, the type of clothing that they wear, and incorporating the regular use of emollients into their lifestyle.
Thank you, Dr. Sheth. Thank you so much for talking to me today.
Thanks very much.